What's up, my healthy friends? In 2022, it's my mission to coach 300 people to get control of their emotional eating so they can lose weight and actually keep it off without counting calories or eating rabbit food. Or smashing cardio, for that matter, because that doesn't get you very far, as we know. Today on the show, we have ourselves a medical doctor that has started out, as many do, as part of the conventional medical system and then made a dramatic change in the orientation of his thinking and the way that he looked at human health problems. I want you to meet Dr. Aaron Hartman, whose journey with functional medicine started when he and his wife adopted their first daughter, whom has cerebral palsy and countless dietary issues. They went from specialist to specialist, and even as a physician, Dr. Hartman felt let down and confused. His daughter's health struggles forced him to confront an uncomfortable realization, which I know you listening are aware of too since you listen to this show, and that is that our current healthcare system doesn't have all the answers. His wife, however, refused to give up hope and ultimately pointed him towards functional medicine, and amazingly, his daughter and other two kids began to thrive. After years in family practice, he felt called to make that dramatic shift towards functional and integrative medicine. Dr. Hartman now helps patients identify leverage points in key areas of their health and lifestyle that harness their body's remarkable power to heal and begin living the vibrant life that they deserve. He's become the go-to doctor for difficult and hard cases in the Central Virginia area in the USA. As well, he does some clinical research, having been involved with over 60 clinical trials. He's the founder of the Virginia Research Center and currently is serving as the assistant clinical professor of family medicine at the VCU School of Medicine and is the founder of Richmond Integrative and Functional Medicine. No small feats here at all. So without further ado, welcome to the show, Aaron. How are you?
Matt, it's great to be here. I'm really excited to share with your community and just glad that we got two people from different sides of the world. We finally got together.
Totally. Yeah, we went back and forth there for a while trying to make it work, but I'm glad we're here.
Yeah, awesome. Great.
So I myself too came from a Western medically dominated background and career, and so I sort of know that system after working in the hospital system for a while here in Australia, and the culture around and the attitudes towards anything that is even remotely different from what we were taught at university. How did you manage to rewire your belief systems about health, nutrition, and medicine to be able to see things through a different lens? Because I know that it's just not something that is socially acceptable in medical circles.
I think for me, it was I never stopped learning. And so I've always wanted to learn. You do your medical school and you're basically, the joke is that you're being spoon fed by the dump truck. You do our residency, you're working long hours. And so when I finished all that, I just love learning. I kept on learning. I didn't stop. And so I just kept on learning things. And my wife, who's a pediatric occupational therapist, one of the things about therapists is that everything they do is outside the box. Everything is individual. Everything's personal. Everything depends on the kid. And so being married to someone who was like telling about these strange, weird diseases that I'd never heard of, and that's like their everyday clinic, just kind of kept me open to the fact that there's things I've never heard of before. And so, I started looking at vitamin D levels and testing those back in 2003 and using A1Cs for screening for diabetes about the same time, which now is even now still kind of not catching on. So it's really interesting to see like what quote unquote cutting edge is not always cutting edge. It's usually decades old information. And so when we adopted our daughter, that was, I think, the accelerant, being told that my daughter needed a feeding tube in order to gain weight, and then finding out that actually she didn't, finding a growth chart for her that the pediatric GI specialist didn't know exist, kind of opened my eyes to, wait a second, the experts don't always know. And then doing that a couple of times with eye doctors and other specialists just kind of helped me realize I need to really be an advocate for my daughter. And so that just put gas in my fire, realizing at that point in time, she was between 2 and 3. And it's like, I need to study and research because I've got a limited time where her brain is super plastic and malleable. And so that just kind of threw gas on my fire and just really accelerate my learning. It's amazing how if you have a personal, if you have skin in the game, we all are educated, we're all motivated, but it's literally when it's like your own kid, your own daughter, it's a different level of involvement, and just it gets you up at 4 a.m. reading research articles. It gets you staying up late at night working on a second board certification, talking to specialists around the world. I mean, I've talked to specialists around the world about lipid therapy, about neural stimulation therapy, about all kinds of things related to my daughter, because that's been my primary driver. And then to take the information and apply it to patients and see how they do, it's like that's it's really cool, to be honest with you. And just keeps you. Even though I'm turning 49 this year and I'm entering my 50th year of life, it just keeps me wanting to learn and not burn out. The way you don't burn out is you keep young, keep fresh, you keep your mind working. And that's kind of what I've been doing.
Well, you definitely do not look like someone who's about to turn 50, if that means anything.
I'm entering my 50th year of life. I'm turning 49. My wife is like, don't round up. I'm like, I'm kind of looking forward to getting into my 50th year of life, so.
Well, you look great. So that's a
Thanks.
testament to the life you live, obviously, right? So I'm curious, what was the biggest non-medical intervention that produced results for your daughter that really started to shift your perspective?
The single biggest thing was actually driven by my wife, which was our diet. When kids with special needs, they usually take formula, which is sugar water, basic with some protein. And that's what they feed kids with special needs. And to see the association with gut health and diet and how your gut is intricately related to brain health, it was a huge leverage point. My son, who's our third adopted child, came to us at 6 months of age with terrible asthma, terrible eczema. My wife would literally sleep with him, on her chest at night because she was worried he'd stop breathing in the middle of the night. And so we radically changed his diet. And, within 3 months, his wheezing was gone. And he's now 11 and he doesn't wheeze. He has no asthma. His skin looks fine. He breaks out a little bit if he eats too much dairy, but that's about it. So, and the diet.
I was going to ask if it was dairy.
Yeah. Well, yeah, he was dairy. And he was, unfortunately, he was growing up on a donut whole diet at 1 to 6 months of age with formula. And that just as an aside, that's not great for kids' nutrition, just in case you were wondering.
Yeah, totally.
Yeah. So diet has been the foundation for all of our kids. And now I've learned, nutrigenetics, epigenetics, all this kind of stuff. And we applied that, but it's been built on top of using food as medicine, whether it's using fats as brain medicine, which is going to be one of the answers to your question. One of your questions at the end is fats are where it's at. So, but diet's been the big thing that that's changed the trajectory of our kids' health.
Yeah, that's powerful. What do you think it was more the subtraction of unhealthy foods or the addition of healthy foods? And I asked that question because, as you would see, a lot of people go and do healthy activities or healthy meals or whatever it might be, and then go and reward themselves with the other food. And it's kind of like, sometimes it's like polishing a turd in a way. It's like, well, I don't know if, putting kale leaves on top of the donuts really makes the donuts any better. So do you find it's subtraction or addition that's the crucial part?
I think the crucial part initially for us was addition, because it was like we didn't go from 6-month-old from Pediacare formula to like amazing food. It was a process. It's really interesting. This study is looking at saturated fats in hamburger, for example, and you eat a hamburger, and there's a thing called postprandial endotoxemia where you eat these fatty thing with protein, and it makes these toxins go up from your gut basically, and they stay up for 12 hours after eating a big old hamburger. If you put a little bit of time on that hamburger, they come down 6 hours. So this is not to say that we shouldn't change everything, but you get a lot of bang for your buck just adding healthy on while you're pulling away the unhealthy. So I like to look at that data and say, look, you know what? If wherever you're at, let's start by adding healthy stuff on, and then we can subtract later. Because the reality is this is a lifestyle change. It took us 1.5 years just to figure out how to source our food. So, I think setting people up for success, I think adding on is probably will make them more successful. But the reality is that if you're eating toxic food, if you're eating toxic fats, trans fats, long chain fatty acids in the processed foods, that's terrible for your brain. It's terrible for your hormones. So, food is such a huge leverage point. I don't want to minimize eating real food, but the reality is it takes people have to learn how to source their meat, source their dairy, source their, think something as simple as kale. If kale's grew in the wrong type of soil, you can have elevated blood levels of thallium from eating too much kale, right? And so you crucifers. It's like, okay, how do you get clean kale? So that takes time for people to learn that kind of stuff.
Oh, absolutely. I think that's a really good answer because, a lifestyle shift unfortunately doesn't happen in a 6-week program or a 30-day challenge and finding out where to shop and which ingredients are in which foods, because even a lot of health foods have very misleading branding and the power of branding is amazing, right? Like just a certain set of colors on a packaging can give you the idea that you're buying a health product that's loaded full of vegetable oil and sugar alternatives and, different types of chemicals and additives and preservatives that are really not your friend.
Yeah, well, I'm not sure what the branding in Australia is like. I don't know if you have these terms, healthy whole grains,
we do.
Okay, there we go. So that's advertising, right? I mean, healthy whole grains. Look at the ingredients. It's not whole grains. Milk does a body good, right? But the milk they're talking about is pasteurized, homogenized milk. Like we talk about water and oil don't mix. Well, unless it's homogenized, then they do. And that changes the food chemistry. Healthy, low fat diet. It's like your brain is 80% fat. I personally think a lot of the neurological issues we're seeing with autism and ADHD, there's actually a prescription drug called Aron in the United States. It's prescription DHA, which is a omega-3 fatty acid from fish, to treat, approved by the Food and Drug Administration in the United States to treat ADHD. Like that's crazy. Like, so a lot of this marketing, healthy whole grains, healthy, low fat diet, these things are actually, it's marketing. It's not actual based on data or science. It's pure marketing. And this stuff goes back to the 1970s and before. So it's just amazing what something advertisement back then can stick for decades.
Oh, absolutely. You mentioned there DHEA and fats, and you commented on fats before. Is like we've seen a big shift in the nutrition world and the medical world too, of those that are on the fringe edge of medicine, which you would probably consider yourself, I would imagine. But like, is this movement towards healthy fats and high fat diets, like, is that the reason that we're seeing all of these diseases of civilization, pop up? Because essentially we're seeing, the diabetes, the cancers, the dementias, the Parkinson's, just explode in numbers. And it's mostly in the Western world or countries that have access to Western foods, bag a box or a can type foods. And they're obviously following that original food pyramid, low fat mantra. Is that part of the problem?
Well, absolutely. There's an interesting fellow, Weston A. Price. I don't know if you're familiar with his work. He was a dentist from the United States.
Teeth, yep.
Yeah, exactly. Traveled the world, went to a lot of primitive cultures, and he saw that basically, literally facial structures, risk for severe tuberculosis, severe infections, longevity correlating. And he was looking at mouth structure, and he saw basically this trend, like westernization of primitive cultures resulted in westernized diseases. There's another guy, a British entomologist, Sir Albert Howard, very interesting book called Soil and Health. And he was like pre-World War II, a British basically guy in India. And what he saw was actually the health of the soil affected the health of the food, that affected the health of all the animals and people in that area. And he basically saw processed fertilizers, synthetic fertilizers, acidifying the soil, affected food and affected health. So we have this idea of processed food going back actually to in the United States, 1908 with Crisco. The thing was crazy that made a big shift. And you look at these health curves of cardiovascular disease and sugar, you see sugar consumption skyrocket to the 50s and 60s. But you see heart disease pop up. But the big increase in diseases we see now actually correlate more with the introduction of the low-fat diet and processed fats becoming a big source. Margarine, your trans fats. Just think about it. If you take a vegetable oil, which is liquid at room temperature, right, and you hydrogenate, you turn it into a semi-solid substance. The plastic in your microphone, the plastic in your ear things, that is taking a liquid and making it into a solid. That's what they're doing with these oils. And that gets in your cell membranes and basically affects cell fluidity. And some of the newer data is showing cell fluidity, or how flexible your cell membranes are, affects how your hormones work, affects how your brain detoxifies itself, affects a whole host of things. And so I think the modern scourge, so to speak, is just where we've removed healthy fats that help your liver detoxify and replace them with toxic, inflammatory trans fats, hydrogenated oils. And that's a big play with a lot of neurological issues. And I use it in my clinic. I do fatty acid analysis on patients, check their brain fatty acid levels. Then I fix those things. It's amazing to see people's chronic fatigue and fibro, to see people's brain fog lift when you just give them healthy fats.
Totally. Yeah. And I guess what you're covering there is all the vegetable oils, right? We're talking rapeseed, canola oil, safflower oil, sunflower oil, that collection of oils that Crisco really kicked off in the early days to send us on the path that we're on now, right?
Yeah. Well, think about a lot of these oils as well. Like actually flax is super healthy. If you're a female, flaxseed is amazing. It can lower your risk for breast cancer like 25%. But if you take those flax seeds and you get expeller pressed oil, if you've ever seen pictures, you can do like a YouTube thing. They actually put pressure to push out the oil from the seeds, and you'll see smoke come off. These omega-3s are heat sensitive. And so if your fish oil is being heated in the process of extraction, or if you're using a solvent, like a lot of krill oil, people don't realize a lot of krill oil and algal oils are actually solvent extracted. Well, now you're taking something that's healthy and you're either using it in some kind of solvent, which is usually a petroleum-based product, or you're pressing it, expeller press, and actually you're slightly burning that oil. Now you've created inflammatory fat. And that's where it's kind of, you can have something that's healthy, start it healthy, and you can turn it into something unhealthy by the way you actually extract it. And that's something a lot of people don't realize. It's not just you're eating, seed oil. The big issue with seed oils is not that seeds are bad or the seed oils are bad. It's like, how do they get that stuff out and then put it in the bottle that you ingest?
Yeah, the manufacture process does all the damage.
Exactly, yeah.
Something that popped into mind just then when you were talking about the processing of krill oil and things like fish oil. There's a bit of debate in the space, when it comes to like naturopaths or dietitians about whether your fish oil supplements are a good idea at all. Some people say 100% of them are rancid. Some people say they're really good for you. Where do you sit on that conversation?
Okay. Good fats are good, bad fats are bad. Okay, so with the fish oil, let's start fish oil, okay? You really need a fish oil to be like CO2 supercritical extracted or somehow extracted with using a cold process. If you're using a solvent process or heating process, you basically made rancid fish oil. Mm-hmm. And so that's the reason I use certain products of fish oil. I don't recommend random products of fish oil. If you take a fish oil capsule and you burp fishy, it's rancid. Mm-hmm. How many people have you talked to? Oh yeah, burp fishy. I don't like I burp fishy. It's like, well, if you eat a nice fresh salmon, mackerel, whatever, you burp fishy, it's old, right?
Yeah, totally.
As far as some of the algal oils, it's really interesting. Neptune, which actually makes about 90% of the krill oil in the world, I actually contacted them a while ago, and I was like, hey, I need to do a solvent extraction. What solvent to use? And is it clean? Like, oh yeah, we use this solvent, but we do a process to remove the solvent from it. Okay, cool. Could I? What's the solvent? We can't tell you. It's proprietary. All right, fair enough. Well, how about your certificate of analysis that says it's clean? Can I look at that? Well, that's proprietary as well. I'm like, okay, so, and this is me as a physician calling them. Like, I want to verify for you, Matty, like, hey, take this great product. If I'm going to tell this as a medical doctor, I got to make sure it's safe for you, right? So I couldn't verify the safety. I had to take their word for it. And I've had a big just intellectual problem, and just forget that part. If you also look at how krill oil is extracted, it's terrible for the environment. It's actually done in a horrible way. You can get small fish, anchovies, mackerel. You can get small fish omega-3s very, very easily. You can actually concentrate using different technologies, triglyceride technologies, concentrate your DHA and EPA, and do it in a supercritical fashion that's clean. It's just a little more expensive, If you want good stuff, it's not going to be cheap.
How is the consumer? Would they make those decisions, and know which to go towards? Is it a matter of contacting companies and going through that process that you just went through?
Absolutely. Either they have to do it themselves or find a trusted source that does it for them. You have to look at the fish oil container. Does it specify, nitrogen sealed? Because like one thing, for example, if you use nitrogen in a bottle, basically it's not exposed to oxygen, so it'll store better and longer. Is it being put in a brown glass container, which blocks UV radiation so it doesn't age as quickly? Do they use some kind of supercritical extraction or molecular distillation process, which is a way of basically getting it out without? And the molecular distillation, you're actually are doing it in a fashion where you actually lower the boiling point, so it's not being overheated. So it's really cool, cool science. Like if they don't say that on the bottle, go to the website. Is it on the website? If it's not on the website, do you assume they're doing it the right way, or do you call them? And that's where if they don't, it's like if you're talking to a farmer and you ask them about how they're doing their stuff. If they're doing it the right way, they're proud of it. They plaster it. They're like, I'm organic. I use these whole husks and I make my compost and I get the earthworms, and they're proud of that stuff, right? I mean, this is a bee guy locally here who he'll just go off on bees for forever. He loves his bees. They're his buddies, right? Like, okay, if you love your bees, you love your cows, you love your kale, you're going to be proud of that and talk about it. If someone's like blowing you off, like, oh, you're one of those, crunchy people who ask me all these hard questions, they're probably not doing things the right way.
That's a great example. And it's the same when we go to the farmer's market or any type of market, talking to the farmers about their processing. And here I know I've got a friend here in Melbourne that called Regen Ray. He's a part of a company called Farming Secrets and sort of helping farms convert to regenerative farming. And he says the same thing, that regenerative farmers, organic farmers are really proud and they want to show you all of their stuff and all of this amazing, how the ecosystem is helping itself, and they're just super excited. So I think that's a very good way to frame communicating with any of these corporate entities that are producing products that we put in our body.
Well, if you ask me about a supplement like vitamin D, let's say, for example, like, well, I'm going to talk about, different oils like an MCT oil versus an olive oil versus a sunflower versus soy. There's different kinds of vehicles for vitamin D. And I'm going to talk about how most soy is genetically modified. If someone's saying not into that level of stuff, are they really recommending the right product to you? And it's really interesting how if you look at something as simple as calcium, for example, there's an interesting article in the United States put out 2015 showing that 25% of calcium you buy in your regular pharmacy had lead in it. And 20% of those was over the EPA level of safe, for a calcium supplement. But my answer is I don't want any calcium in any lead in a calcium supplement.
Yeah,
and so,
me neither.
Yeah. And so it's just kind of crazy. If you start making due diligence and looking at stuff, it's crazy how much stuff is tainted, and yeah, it's kind of crazy.
It really is crazy. What do you find with your sort of medical circle? Is that with the shift out of sort of a primary focus of Western medicine to integrative and functional medicine, have you found that any more challenging to communicate to patients or to get them on board with this new kind of thinking or methodology when you made that shift?
I think patients that are educated are aware of it. It's just it's a big educational process. You talk about half of all chronic disease in our country can be directly attributed to eating processed foods. People nod like, yeah, I believe that. Okay. Harvard School of Public Health, one of the top medical institutions in our country and the world, says 80% of heart disease and 70% of cancer can be prevented by diet and lifestyle alone. People are like, yeah. They get into it. Okay, let's look at your diet. Oh, well, I do fast food and I skip meals, and when I eat, I eat this powder from XYZ. And so a lot of it's just educating people, not just giving them mental assent. I think people understand. When it can get a little granular when you start about clean water and clean air and all that kind of stuff. People might think you're a little crunchy, but when you talk about the basic stuff,
too far down the rabbit hole.
Yeah, but if you talk about the basic stuff, like, hey, half of chronic disease, everybody sees more dementia, everybody sees more kids with autism, everybody sees more diabetes, everybody sees more obesity, everybody sees all these things, and to correlate that with our diets, it's not hard for most people to grab onto. It's just then how do you actually change people's lives, and that's where people kind of get a little lost, which is one of the reasons I make a big deal about education and talking about this kind of stuff, because people have to wrap their brain around it before they're going to wrap their hands around it.
Yeah, that makes perfect sense. And do you find just communicating what you just shared, like saying that this type of food is bad or this type of food is not good for your health or whatever it is that information enough for people to start making those behavioral lifestyle changes? No, people need to, okay, so great. Like, bad fats are bad or whatever, or bad dairy is bad. Well, in my area where I live, what does that mean for me? Because I like cheese, I like dairy, I like cream, I like whatever. Mm-hmm. You have to also empower people. Okay, these are the products you can buy that are better. This is what you need to look for in a olive oil. People don't realize that. I mean, again, I'm speaking from an American perspective. I don't know what the rules are in Australia, but here, it's very similar in Australia. We just have a slightly different culture, but yeah, the way the system works is very similar. Like in America, you can have a olive oil that's still labeled olive oil, and up to half of it can be another oil. It could be a canola oil or another, or a soy oil. So just telling people, look, first thing to do is look for extra virgin, cold pressed olive oil. Mm-hmm. Okay, that's a starter. Well, people start looking for it, like, wait a second, actually, most of it doesn't say that. And when it does say that, it's almost twice as expensive. And it's like, well, there's a reason for that. It's really funny. Like, we have a local place called the Olive Oil Tap Room where I'm at, and they basically direct order stuff from over in Italy and Greece and North Africa and stuff. And typically their oils in their shop are usually, they get there within 3 months of crush date. So it's like a spring and a fall crush date. So say the spring crush date's like March, April. So it's coming in their shop like June, July. If you go to like Whole Foods or go to some other place like that and look at the dates, usually crush dates are a year ago. Mm-hmm. So, and one thing you have to realize about olive oil, about 18 months, you start getting a breakdown of the polyphenols in the olive oil. So something as simple as that, like just when you start realizing, actually, how can we get closer to the source, for everything? And it's a process. It took me a year and a half to figure out how to source cheese and meat and dairy and, my oils and different things. And it just, wherever people are at, they have to be interested first, and then it's going to take a bit to actually start figuring out how they get a hold of these things. Mm-hmm. Do you speak much with your clients, patients, about sort of the psychological component of their behavior change?
Absolutely. There's an emotional attachment to food. There's emotional eating. There's, in the United States, convenience is king. It's super easy to get something fast, the microwave something, there's all these impediments, to healthy living takes a bit. It's going, you have to make meals. You have to actually source stuff. And so it takes people having to realize that actually in order for my health, if my health is really, truly important to me, am I going to just work out, 20 minutes twice a week? Or am I going to actually move more? Am I going to only sleep 5 to 6 hours at night? Or am I going to try and make it close to 7 or 8? And so there's definitely a psychological component, especially when the norm is poor sleep, poor diet, poor exercise, obesity. In the United States, 80% of Americans have insulin resistance. Half of our country is diabetic or pre-diabetic. And so you got to realize that's what you're talking to. You're talking to a group of people that are mostly on the spectrum of some kind of metabolic disorder, some kind of cardiovascular disease. And you have to not change not just your thinking, but the motivation. People have to get buy-in, and that's an educational process. That was really interesting, right? Back in the day, smoking cessation, right? And the whole thing was I have to talk to the average person who smokes. I have to recommend them to stop smoking 7 times before they attempt once. Mm-hmm. And so I have to have a relationship with a person. So, hey, Matty, how you doing? I'll see you again. And they realize it might take me 7 recommendations for you to do a lifestyle change before you even attempt it once. So this takes patience on the practitioner's part. And also just to realize that education and repetition is the mother of all learning. And we have to hear things over and over and over again before we actually will appropriate. That's marketing. That's how people see things and buy them. That's marketing. So in many ways, a practitioner is a marketer. We're trying to market healthy lifestyle, healthy diet. And that takes repetition. And you have to do it in a way that doesn't offend your patient. Oh, you're going to kill yourself eating that thing. You're going to die. And you hate your family. You hate yourself. Like that person's not coming back. You'll get your one time.
No way.
Yeah. And so you have to be, that's always been my philosophy. And you have to be willing to accept people where they're at. I realize it might take multiple times before someone attempts once. And it's going to take, and it'll be failures, and that's okay.
Totally. And that's the exact reason actually that I adopted a model where I don't actually do one-on-one sessions. And what I mean by that is single sessions. I encourage people to buy, a series of sessions or a program with me for that exact reason. Yeah. I have people knock on my door every now and then and say, hey, can I just book one, half an hour session? And I'm like, nothing's changing. Nothing's changing in that half an hour session.
What's interesting, Matty, because I do a membership thing where people sign a contract for a year for that very reason. Because what happens is now every time they see you, it's like, what costs me this much to see you? Versus if you remove that barrier, if you can get over this hump and commit to a year, commit to how many sessions or whatever, then you've already gotten the biggest hurdle out of the way. And then it's like, I got this time to work on this in repetition, whether it's through podcasts, whether it's through newsletters, email lists, whether it's through working with a coach, coming to see me in person. It just takes a lot of repetition. And that's huge. That's actually, it's really interesting in my world in the United States with functional medicine. One of the models is putting these packages together or memberships, because not just from a financial model, but actually if you want to change people's lives, they have to commit to you just as much as you're committing to them. If they're only commit one office visit, it's or one time off just to take you for a spin. Unfortunately, most people you see in that model won't make massive changes. And that's our current healthcare model, actually,
Yeah, absolutely. And in Australia, it's about 7 minutes, which is probably similar to the US, right? Per session with a doctor. Yeah.
We actually have some really close friends that are actually from Sydney, Australia, that we know from church. And it's really interesting to listen to their perspective of healthcare and how stuff works. And it's like, it's really, really similar. Yeah.
I think the big difference that Australians don't realize is Australians are much more subdued compared to most Americans and American culture. And so you go to America and you see billboards with drug advertising, you see TV ads with drug advertising. And so we don't see that here in Australia. So Australians think it's not the same, but behind closed doors, the business is exactly the same. The finances are exactly the same.
Well, it's interesting, Matty. There's only 2 countries in the West that actually allow direct-to-consumer advertising for drugs: the United States and Holland. All the other countries don't allow it. And it's really interesting how in the United States, one of the results of that is people, I have an advertisement for this drug. Ask your doctor about XYZ. And if I got 7 minutes, it's a lot easier to say, sure, you can try it. We'll talk to you later. then is to sit and talk to you about how this new fancy drug actually doesn't work that well. There's this new Alzheimer's drug that I won't mention that you may have heard of. It's called Adulam. I'll just mention that. But it's actually helps affect formation of beta amyloid, which everybody thinks causes Alzheimer's disease. It doesn't. If you look at the brain of someone who's 80, you cannot look at their quantity of beta amyloid and tell a difference between someone with Alzheimer's and doesn't have Alzheimer's. It's an epiphenomena. There's something else going on that results in this, and so it's one of those things where when someone's being advertised to, it's going to take me a long time to educate someone about what's actually causing dementia and how the neurofibrillary tangles and beta amyloid aren't the primary thing. They're a secondary thing. The primary thing is all this other stuff: inflammation, toxins, glycotoxicity from sugars, heavy metals, sleep apnea, spirochetes, Lyme, all this stuff.
Well, and the cumulative effect of a lack of sleep, so the glymphatic system hasn't been operating perfectly for decades.
Absolutely, yeah. And so all that stuff, it's like, I got 7 minutes. Here's your trial of this drug. Come back and see me in 3 months, right? And so when the system's kind of set up like that, you're going to get prescriptions, not answers and true help, in my opinion.
And there's this kind of terrifying regulation in the opposite direction, which is like for cancer, for instance, is like it's illegal once somebody's diagnosed with cancer to not use chemo, radiation, or surgery. Like it's illegal. Like you're not allowed to offer any other alternatives as a doctor here in Australia, which is terrifying. So it's
that's
like
actually
really
Australia,
scary.
That's actually illegal.
Yep. It's if you're a doctor recommending like alternative therapies, you can get in big trouble.
Wow.
I worked for 7 years in a cancer hospital. It's shocking.
That's crazy. Wow.
Yeah. So, and we've got to realize too, a lot of society looks up to our medical doctors, and not that they shouldn't be, they're not worthy of that, but they are also a regulated system, highly regulated.
Well, the other thing to think about, like the way I look at, there's like with COVID, for example, there was, why did it take us so long to figure out vitamin D was a good thing when we had data going back to flu and influenza and other viral diseases 20 plus years? The whole idea of vitamin D, your Th1 and Th2 immune system, when your body makes antibodies, if you have low levels of D, it takes longer for your body to ramp up your antibody levels, right? So it wasn't a big stretch to say, hey, maybe we should consider this. And in the UK, they were actually mailing vitamin D to high-risk individuals while we were debating, if it's, quackery in the United States. We have literature going back decades on this. And you have to realize that medicine is largely by consensus. The Ignaz Semmelweis, the guy who invented hand washing in Europe, it took 30 years to catch on. That's crazy. Smoking in the United States took 50 years and 7,000 research articles before the top doctor in the country said, hey, guess what? Smoking causes lung cancer. And so that hasn't changed. And so if you want to be at the tail of the era, the back end of things, and when this general consensus, it can be 20 years before you're changing how you do stuff. And that's where, staying up with the literature is hard. It takes a lot of work. And it's, in our model, our insurance-based model here, insurance doesn't pay for me to implement novel new things. It pays for me to implement standard of care things, which means I'm always practicing medicine 20 years behind the scientific curve.
So if you want good health now, be an early adopter.
Well, and one of the things true, but as a medical doctor, I also take very seriously my oath, first and foremost, do no harm.
Of course.
And so when you realize that iatrogenesis, which are things doctors do, misprescription of medications, complications of surgery, mistakes in the hospital, when you add those all together in the United States, that's the 5th most common cause of death. So I take very seriously, like first and foremost, stop, do nothing is what I'm recommending going to be. What's the risk? And you talk about a lot of these integrative functional medicine modalities, they have to be at least as safe, if not safer, than standard of care. And many times they're way, way safer.
Mm-hmm. Yeah, oh, absolutely. And it's much harder to overdose on vitamin D supplements than it is on any medication.
True, yeah.
So for people listening, they've probably got family members, partners, or maybe even themselves that are, heading towards, that's probably why they're listening. They're heading towards some of these unfortunate health outcomes, the diabetes, cancer, or they're looking to their parents and thinking, oh, is that what I'm destined for? So what's the advice for people that are listening right now that want to unwind their disease or their likelihood of disease?
Well, you got to realize, the old model, the 20th century model is genes cause disease. So when I was in medical school in 1996, I was told cardiovascular disease is 80% genetic. Well, now we know it's 5%. You know, in the 1950s, if you had the BRCA2 gene, BRCA1, BRCA2 gene, you had if you're a female, you had about a 20% chance of getting breast cancer. Today, it's 80%. So even if you have the gene, quote unquote, we've seen a 400% increase incidence of breast cancer. So you have to realize that the genes load the gun, but the environment pulls the trigger. And that's where diet, exercise, sleep, relaxation, relationships, there's a huge association. This is one of the things that COVID's been so bad is we lost our social connection. You know, relationships actually improve people's ability to handle stress. Kids that actually grow up in a stable home, when they have an outside stress, they're less likely to interpret that as trauma than kids who don't have a stable home. So all of a sudden now, these things are huge for our health. So my baseline recommendation is do the foundational basic stuff. You can do all the fancy stuff, taking curcumin and fish oil and D and C and zinc and NAC and, you know, blue lip muzzle extract pulled from the Marianas Trench or whatever kind of bizarre stuff, you know, Shilajit that comes off the western side of the Himalayas, you know. You can do all that cool stuff, right? But ultimately, those are supplement, and they supplement the foundational things. So I tell people start from there. You know, if 80% of heart disease can be prevented by diet and lifestyle alone, if 70% of cancer can be prevented by diet and lifestyle alone, then that's where you start. That's where you finish. But then you add, as you're coming around full circle, that's where you add the cool things in.
Yeah, absolutely. Yeah. You are in the driver's seat, believe it or not. And I think that's one thing that Western medicine has influenced in a bad way, is that taking people's intuition and independence away from their health. It's like, no, I'm the doctor. I know more about you than you know about you. So anything you feel is right or wrong, disregard those internal signals coming from your brain and just do as you're told. And so it's almost like this reintroduction to one's own body that they have to go through to be like, oh, my body's actually giving me feedback and I need to interpret that.
Well, Matty, do they have the big stress in Australia with evidence-based medicine? Is that a big thing there?
I'm not familiar with it, no.
Okay, well, evidence-based medicine is this big thing here, looking at science and data and literature. But and it can actually start from an article in the, I think in the Journal of American Medical Association. It was like 91, and the triangle of evidence-based medicine was clinician experience, scientific literature, and patient preference. That's what it's supposed to revolve around. And what it's become is scientific evidence and nothing else. And the thing people don't realize is that half of what I know now will be obsolete in 5 years. And and this is from the PLOS, Dr. Aaron this is actually the biggest online medical journal in the world, that half of all published now, not preprint articles, right? You know, this is actually published stuff. Half of the findings are later found to be false. So you got this world where half of what I know is obsolete in 5 years, when medical knowledge is doubling every 18 months, and half of what makes published is later found to be false. You really need experienced clinicians who have a lot of history, and you got to take the patient's preference into account. And if you don't do that, it's a recipe for disaster.
Yeah, totally agree. It reminds me of my grandmother at the moment, who's getting on in her years and dementia's starting to come in. But even before the dementia, like every sentence she says is about what her doctor says. Like she's got no thought of her own about her own body or her own situation or her own health. It's just like, I was told to do this, I was told to do that. And I often ask, I'm like, Nan, what do you think about this? And she's like, oh, I don't know. This is just what I'm told to do. And it's like, we've got to go through a process of people taking their independence back in a way.
Well, it's also something that's generational as well. When, like when you had like, this vaccine for polio saved my life. This antibiotic for pneumonia saved my life. Like back in the day when, if you look at the way things were in the 40s and the 30s and back in the day, a quarter of kids dying before they made it to adulthood. Maybe 1 out of 5 women die in childbirth. Like the numbers are pretty bad, to be honest with you. I mean, in the United States, the average life expectancy in the 60s was about 62 years old. And so like when that was what the foundation of what our system was kind of on. Now the most common cause of death is actually chronic illness, not acute illness. And so our model of delivery of healthcare has to change with the times, and still stuck in the same system that my grandfather and your grandmother is getting. And it's time for that to change.
Yeah, absolutely. Where can people find your amazingness online? Because I've listened to a bunch of your stuff and you've got so much to offer. So where can people listening find you?
Well, richmondfunctionalmedicine.com is my website, and that's kind of my hub for All my educational stuff, my community, all of our things are right there. And it kind of goes from there. I do podcasts like this, and we usually share that on our social media. But richmondfunctionalmedicine.com is my starting point. So
amazing. Well, for everybody listening, I'll put that link down in the show notes below. So make sure you check out Richmond Functional Medicine. And anything else we've mentioned here will be down in the show notes below. If you've enjoyed this episode, take a screenshot, pop it up in your social media, tag us both, on all of the socials that we're all on. And to wrap up, what is one piece of health information, Aaron, that you wish more people knew about?
I wish more people knew that healthy fats can actually change the trajectory of their health. Healthy omega-3s, omega-6s, healthy saturated fats, healthy lean fats, omega-9s and extra virgin olive oil. These things actually are super powerful for brain function and for gut function. They have anti-cancer properties. They have anti-inflammatory properties, and something you can simply put in your diet just by changing out your oils and changing your diet habits. So, and plus a little fat in your diet actually makes things taste a lot better. So that's one of the revolutionary things I've been studying, lipid medicine. It's called lipid medicine actually for the last 5 years or so.
Tastes better and you feel more satiated, so you're less likely to go continually filling that binge eating rabbit hole.
Exactly. And it's healthy for you.
Yes. Aaron, thanks so much for being here. I'm really grateful for your time.
Thanks, Matty, for having me. I really appreciate it.
No worries. We'll catch you soon.
All right, take care.
Bye.